Okay. Hey guys, we're here to talk today about pelvic pain. We're a day early, but they're going to a conference tomorrow for opioids. Yay! Whoop, whoop. So we're doing it today. So today we're talking about pelvic pain. And I know we've already talked about endometriosis and how they're very, very closely related. But we'll dive a little bit deeper into pelvic pain today.
All right.
So I have a question from a viewer wanting to know how common pelvic pain is in women.
It's probably, besides annual examinations, the number one reason why I see patients. So common. There's so many different reasons why people have pelvic pain, and unfortunately, a lot of patients kind of just said, oh, they've been worked up, and then kind of been brushed away and told, there's nothing you can really do about it. But I think you just need to have a provider who does a good workup and can make sure that we can address all the issues. But anyway, I digress.
So I know a lot of times pelvic pain is associated with endometriosis. They kind of come hand in hand.
Yeah.
But how often do you see pelvic pain outside of endometriosis and some of the causes of that pelvic pain? That's not endometriosis.
Yeah. Well, the way I see pelvic pain is a kind of divided system. So you have pelvic pain that's due to the gynecology organs, namely the uterus, fallopian tubes, and the ovaries. And then you can have anything within that category, if you will. You can have fibroids causing pelvic pain. You can have ovarian cysts causing pelvic pain. You can have endometriosis, which you mentioned, that causes pelvic pain. Ectopic pregnancies can happen. You can have cysts on your ovaries causing pelvic pain. And then you can have inflammation like endometritis, which is inflammation of the lining uterus, or inflammation of the cervix can occur. You can also have like infections on the ovaries, something called a tubal ovarian abscess. So that's kind of like in general, the GYN causes. And then you have to think about the other systems that are involved. There's a urinary system, which is right next to the female parts, and you can have bladder issues from cystitis, or basically a urinary tract infection. You can have IC or interstitial cystitis causing the pain. There can be pain from swelling around the ureters, which are the tubes that connect the kidneys to the bladder, that can be blocked up. You can have pelvic pain from kidney stones. And then the next system I think of is the GI system, the gastrointestinal system. Colitis can cause pelvic pain, like from irritable bowel syndrome. You can have ulcerative colitis, you have Crohn's disease, just a whole host of different things.
A whole lot of them there.
Yeah. Musculoskeletal pain too can cause a lot of pelvic pain. If you like the musculature in the pelvis, like the levator ani, can be tight and cause a lot of pelvic pain too. So yeah, it's a very common thing, and a lot of times very difficult to work up. But
it was kind of that you said that leading into the next question of when someone comes in with that pelvic pain or that lower abdominal pain, they've started the initial visit. What are some of the workups that a patient can have done to kind of help find the diagnosis as to what's causing that pain?
Well, first thing we need to do is get a really good history, because that kind of shows us what track we should follow, if it's more gynecological or if it's more of an intestinal problem. So a lot of times we tried to see if there's a pattern to the pain, if it maybe happens consistently with your periods, or does it happen after you exercise. So a good history is always the first thing that we try to get, and then we kind of go down, decide which path we should take. If it's kind of the lower abdomen, we want to make sure there's no urinary tract infection, so we do a test for that. Frequently we'll make sure that there's no vaginitis, which is inflammation of vagina. It could be due to something called bacterial vaginosis or yeast infection. Yay! So we do an initial workup, do a physical examination if it's related to the female pelvis, and just kind of go from there.
And when should a patient, do you think, kind of seek that immediate attention? If maybe she's been tolerating it for a long time, or maybe it just all of a sudden happened. When do you think, they call and say, oh, can I get an appointment? And, oh, we're booking 3 months out.
Mm-hmm.
When should they kind of seek that immediate attention or quicker attention?
Mm-hmm. Well, I think if you're having extreme bleeding, and also really, really bad pelvic pain, like you feel you're dying, then definitely you need to come in. In our world, I guess the most acute problems that we address is a ruptured hemorrhagic cyst or an ectopic pregnancy. Those are the two problems that potentially could need surgery. So if you have those two symptoms really bad, pelvic pain that, it's a 10 out of 10, or extreme vaginal bleeding, that's probably something that needs to be seen immediately.
How often do you see that pelvic pain might affect somebody's fertility?
It kind of depends on what the etiology is of the pelvic pain. Frequently, we do see endometriosis, and what can happen with endometriosis is that the little implants from the endometrium or in the fallopian tube, it cause inflammation leading to scar tissue in the fallopian tubes. So some women, unfortunately, can't have babies because of that. So that's kind of a quick and dirty.
And then one of the biggest questions, speaking of the opioid crisis, when a patient is experiencing that pelvic pain, if they don't feel like it's maybe bad enough to seek medical attention, they feel like maybe they can tolerate it, or they don't want to admit it, or for whatever reason they're not wanting to address it. What's maybe the best management of that?
Basically, I would say see a provider. I know it's kind of a lame answer, but there's so many differentials and so many different reasons. I mean, yeah, the pain may be fixed with narcotics, but I kind of see that as kind of like a Band-Aid to taking care of pain. It shouldn't be a long-term treatment. So I think the most important thing is to kind of get at the crux of the problem.
So seek attention. And then, what are some of, did we already talk about some of the tests that can help diagnose pelvic pain?
So there's several tests that can help pelvic pain diagnosis. It can be as easy as like checking your urine to make sure there's no urinary tract infection. We can screen for gonorrhea, chlamydia. Sometimes it might be due to endometritis or an inflammation of the lining of the uterus. Usually we treat that clinically, but I suppose if you're really wanting a definitive diagnosis, you could do endometrial biopsy just to confirm that. Some radiology tests that we order frequently is a pelvic ultrasound, and what that does, it looks at the uterus, fallopian tubes, the lining of the uterus and the ovaries. More in-depth testing can be with a CT of the abdomen and pelvis, and that gives us a different perspective of the pelvis and the abdomen. It's a better test for beyond the uterus and the ovaries. We can also do tests for blood work to see if, kind of in general, like is this pelvic pain causing anemia, such as in like adenomyosis, which is a specific type of endometriosis. But again,
that initial workup pretty crucial when it comes to such a broad area, and with, like you said, so many different things that can be causing it.
Mm-hmm.
It's hard to, like you said, let's just put a Band-Aid over it and carry on. So if there is a patient that's getting her initial workup and maybe she's in the process of having some labs drawn and she has an ultrasound scheduled in a week, and she's, maybe taking ibuprofen or Tylenol or something over the counter to help ease the pain. Are there any other kind of at-home measures that they can be taking to help minimize the pain? Kind of outside of medication.
That's kind of a tough thing, again, because it's like, what's causing the pain?
Right.
But in general, you can take hot showers. You can put a heating pad on top. Decrease your activity so you won't exacerbate the pain.
But nap. Naps fix everything.
I prefer to do that in naps.
A nap can fix everything. So we have a super short Facebook Live today. We've got a few patients in the clinic and we have more patients coming in right now. So I apologize, we were a little bit late today and we're cutting it short. But we do have patients we need to go see. So if you have any questions, any concerns, anything, email them, call us, comment on here, message us on Facebook, schedule an appointment. Come see us. But otherwise, I hope everyone enjoys their Thursday. I can't say happy weekend yet because it's not Friday, but happy weekend anyways. And we'll chat soon. See you later.